What is going on with Donald Trump's health? And I say this in the most serious way possible, that there is something very seriously wrong going on. We know that there's a cover-up taking place where he said that he got an MRI after he was basically cross-examined over and over again. Now he says he doesn't know what body part it was done in, but we see his behavior. We see it every day. And it appears to be infecting just the day-to-day things that he's doing. You know, since I reported with Dr. Vin Gupta, who runs Meidas Health, early last week about this, we've seen a number of articles come out about this as well. I mean, a New York Times piece just dropped that talks about how Donald Trump starts his day at 12:08 p.m. Starts their day at 12:08 p.m. If you're the president of the United States, that's when he does his first event. Also, you see that his official appearances have decreased by about 39% this term versus his prior term. And at least in his prior term, he started at 10:31 a.m. I mean, not great for the president of the United States, but now he's starting at 12:08 p.m. You know, then there was the ordeal with his meeting with Mamdani in the Oval Office, the mayor-elect of New York City, last week. And there were so many, apparently, of Trump's aides who were so disconcerted about Trump's, I'm being honest, mental health, about what he was doing, and if he thought he was a different person at that time. And people said, we don't, the way he was looking at Mamdani, the way he was almost like attracted to him, like it was if Trump like forgot the role that he was playing. And Michael Wolff, who you've seen on the MeidasTouch network before, who's got great sourcing inside the White House, he went on the Daily Beast. They have a great podcast that they do there with Joanna Coles. And here's what he had to say. Let me show you this clip right here. Let's play it.
About the idea that somehow Trump is playing three-dimensional chess.
I'm glad you asked, because this person who I was who was really just flabbergasted by the whole thing said he doesn't play 3D chess. He has one game, and this wasn't it. And you know, the implication here is that something had happened here. There was some really alarming mood swing.
Is it possible he's had a stroke over the weekend? We had Dr. We had Dr. John Gartner on the podcast last week, and he was saying that, you know, there are clear indications that something has gone wrong.
I don't.
His leg. He's got a droopy mouth.
Would be. I mean, this was certainly the suggestion, and you know, the point this person was made, and I think it's a fundamental point about Trump, is that he stays in character, which is of course what he does. What is his training? 14 years as a star of a hit reality television show. He is in character. And this person, the view was that this was so weird that that he's on the set, the cameras go on, and suddenly he's playing an absolutely different part. And this person said, and this was as you can see, I wrote this down, all of this down, because this was like riveting. So he says, literally, the only explanation was that the guy forgot who he is. So weird, he says. And then he said, it gives you a 25th Amendment shiver.
Wow, the 25th Amendment being when you can remove the president because he's no longer in sound mental health, sound mental state.
Yes. So at any rate,
wow.
I mean, I don't know. We're just encapsulating that one moment. But the people around Trump saw that moment, and they were, to say the least, startled.
Here's what Dr. John Gartner had to say, and you've seen his show on the MeidasTouch network before. Here's what he says.
He may have Alzheimer's. His symptoms seem to point more towards frontotemporal dementia. In dementia, we see deterioration in at least 4 main areas. Language. During the campaign, there were supercuts of people making fun of him for his mispronunciations or malapropisms. Memory, we talked about last time about his not recognizing Hakeem Jeffries. Behavior, his disinhibited behavior. And then finally, psychomotor performance. It appears like it is on the right side of his body that he had the droop with the face. It's also on the right side of his body that he has the wide-based gait where he swings his leg in kind of a semicircle. And what we're seeing is consistent, gross, progressive deterioration in all of these 4 areas. In dementia, very overlearned motor behaviors, things we don't actually think about because they're so overlearned, those programs start to deteriorate. One of the things that I'd like to point out is I believe his doctors who have examined him know that this is not within normal limits. And I think the information that has leaked out is enough for us to conclude that they know he has organic cognitive decline. If Donald Trump were just an ordinary patient and you saw these kinds of serious signs of dementia, a responsible doctor would give him both a neuropsychological battery and an MRI.
I want to bring in Dr. Vin Gupta, who leads Meidas Health, pulmonologist, 20 years or so in public health, devoted your life to improving the health of this country. You and I reported on our observations, and I specifically, asked you as a medical professional what you observed to Donald Trump. And it seems since we brought this back to the forefront and simply saying there are issues here without really getting into making any medical diagnosis per se, but just saying there's clear issues here and here's why it's important. This is getting a lot of attention right now. And so I wanted to first kind of follow up with you since our last report, because I think it's been making a lot of waves, both in the kind of public discourse and then kind of more broadly, with medical professionals chiming in and saying this is not normal stuff. What do you think about all of this?
Well, Ben, that was an incredible tee up, and you're right. You don't, as president of the United States, begin your day at 12:08 p.m. You were likening that offline to what we used to do in college, and that's right. That's not a normal time when you're older to be starting your day. In fact, as we get older, we should be starting our day a lot earlier because we tend to not get enough sleep. And so as you get older, you actually wake up, and that's why our parents or our grandparents are up at 4, 5, 6 a.m. in the morning. Good sleep time gets harder to do as you get older. And so the fact that he's, mobilizing and starting his day at 12:08, per reporting from the New York Times, is concerning. That's one. Two, as you pointed out, you and I had this conversation last week. We took pains to not speculate because I think a lot of people like to speculate. And I think based on the conversation we started, a lot of people have started asking questions. But it's clear that there's age-related cognitive decline. That's obvious. His response to somebody fainting in the Oval Office really conveyed that. He didn't show any signs of concern. He didn't really do anything. He was slow to respond. And that slowness and fatigue you're seeing more and more in his public events. So that's one. Two, he's confused a lot. Three, he sometimes mumbles sort of incoherent nonsense when he's asked a question in the press pool in the Oval Office. So all these things, when this constellation of just him being him. Imagine if President Biden did any of those things. He did a fraction of it from what I saw, and the lead up to the 2024 election, and people obviously forced him out of the race. You're not seeing that level of scrutiny until maybe now you're starting to see signs of it. But, President Biden was active on the weekends, especially riding his bike in Rehoboth Beach. Physical exercise was something that he was clearly doing, and we had visual signs of that. From a cognitive standpoint, sure, you slow down once you hit your late 70s, early 80s. No one denied that with President Biden, that he had his moments of being 80 or 82, whatever it was. In this case, the White House is not willing to even acknowledge that the president is showing obvious signs of age-related decline, one. But two, you don't see him ever really doing anything physically active the way that President Obama, President George W. Bush, President Biden, though our last three presidents prior to Trump, regularly worked in to their daily life. I mean, Biden was biking, he was exercising, he was walking, and he made a point of creating that visual to convey that was a big part of his daily existence. He made a point of engaging the press on the weekends. When he was biking in Delaware, you don't see any of that. And physical activity is one way to really guard against the onset of cognitive decline, dementia as we get older. So I worry about that as well. He might take trips out overseas in Air Force One. That doesn't substitute for the lack of physical activity. So Ben, when you put it all together here, clearly something is happening. And clearly they're not getting MRIs just because that's just at the moment that we live in. There's a reason, and they're worried. And frankly, that's piecing this all together. There's a reason to be worried based on his public performance.
And we should easily know the answer. And the way we would know the answer is that they produce the MRI result and they can show you it and not say this MRI result shows that Donald Trump was a great golfer, or this demonstrates that he wins golf championships, or that he's in the most peak physical health of anybody in existence. Like, it's just stupid. It's like, stop. Just show us the report. You could show us the data. We're dealing with the president of the United States here. If you say it's perfect, let us know which body part it is and show it, right? Then that would be cleared up. Like we could move on. We can move past the speculation of, the health version of what's in the Epstein files, what's going on let's find out the answer. And then we can have a real conversation. I think that's a lot of the frustration that exists, because you're going to have rampant speculation, and we should have transparency.
Yeah, we should. And we don't have that. And we talked about this last time. His position is editorializing, exactly to your point, saying that using words like best ever and, just phrases that you would never use to describe somebody's physical exam. It's black and white. It's the facts. Give us the facts. Speak medically, don't editorialize. But he's not doing that. So his professionalism, the physician to the president's professionalism, I would call into question. But then two, produce the results. Why are you getting the MRI? There isn't a clear reason. This is not, and I know that he has some defenders in the media, medical doctors, especially on Fox News, who try to push me on this. You do not get an MRI without a reason. And if you're doing it for a quote unquote screening purpose, you're doing that for a reason. Traditional then primary screening tests, cholesterol panels, CT scans for people with a long history of smoking, for lung cancer detection. Those are screening tools, primary screening tools. You do not ever get an MRI for a primary screening purpose unless there's a reason to do it. You're at elevated risk for a condition. We know you have, say, cognitive decline, potentially in the case of the president. There has to be an additional reason to jump for that MRI. For them to decline that, or to say, oh, well, all the ultra rich are getting it, that's why we're getting it for the president, that's not sufficient.
This brings us to a related issue, because someone in Donald Trump's age, condition, place in life, it's natural and normal, you're going to have to rely on nurses more. Nursing care, when you show up at the doctors, the first people who often see you are the nurses. These are heroes, the front lines of our medical system, often underappreciated, grossly underappreciated for the incredible work that they do. We at the MeidasTouch Network have always worked very closely with nurses and nursing associations, because I just think it's important to uplift, especially the contributions that they provide. So we've worked with Justin Gill before in the Washington State Nurses Association. We've helped him organize with other nurses associations to originally write letters in opposition to RFK Jr., which was the right thing to do. Unfortunately, Senator Cassidy didn't listen. But but one of the things we see now is the very nursing profession under attack by the Trump regime. And part of me thinks it's retaliation when the nurses were on the front line in COVID, and those videos that you saw where the nurses were there and standing up against not just the regime at the time, but standing for correct science and against, all of this disinformation back then. But you have them, and I want you to explain to people what's happening here, how the Department of Education is basically saying, and why they're doing it, because it has a money impact. At the same time, Donald Trump says, we're so rich, we're so rich. But the way you're trying to save pennies is by de-designating nursing as a professional degree and just thinking about the FU to nurses. And I just think, Dr. Gupta, right now, with so much suffering happening in this country before Thanksgiving and so much we could do for people, the fact that there are people in this Trump regime sitting around saying, what's a great idea? Let's screw over nurses. That's the group that we're going to. Then someone else goes, great idea. Hey, Linda McMahon, hey, WWE wrestling person, what do you think about this? Tell us what's happening here.
Yeah, it's the progressive de-skilling of arguably the most vital profession in all of medicine, because nurses spend more time, and all doctors would admit this, with our patients than doctors can, unfortunately. We have to jump around and care for, I'm in my ICU, I'm caring from 10 to 15 patients, critically ill patients on a shift. They need my attention. Nurses, there's maybe in a lucky situation, it's 1-to-1 patient to nurse, and that nurse is in that room for a 12 to 14-hour shift doing back-breaking work, literally nursing a patient back to life. There is no question nurses, Ben, are a professional specialty. They represent a professional specialty. The work they do is a professional set of skills. It requires a skill set that requires going to a professional school, which requires being able to draw against loans from the federal government than any professional degree that is offered in the United States of America is able to draw against. There's no reason why nurses should not be able to draw against the same limits that doctors, that lawyers, that other dentists are able to draw against. And here's what's happening here. They're putting these artificial limits. They're saying basically that because they're not considering nurses, or most nurses across the country, holding a professional degree, that what does that mean? That means that if you wanted to go and upskill, so you're a nurse, you got trained to be a nurse, and you wanted to get more skills. You want to be an advanced practice nurse, which, by the way, the country is needing more and more of, Ben, because we don't have enough doctors. Often an advanced practice nurse is the most skilled healthcare professional in an entire county, much less a hospital. I work with advanced practice nurses to staff ICUs in parts of the country, especially in the military. In my military role, we have advanced practice nurses really stepping in and filling key healthcare workforce gaps across the country. And this is exactly the group of nurses that this policy is going to target. The most skilled nurses in the country that are doing critical things for our healthcare system, for our patients, no longer are going to be able to get a graduate school loan that will fully fund their education through the government. They're going to have to figure out a different way. Makes no sense, considering we're in a workforce shortage when it comes to nurses. One, it's only going to get two. It's only going to get worse with the baby boomer generation needing more and more care over the next 5 to 10 years. We need more skilled nurses. We need more advanced practice nurses to fill key gaps in hospitals across the country. And two, I think the other thing we need to keep in mind is people want to need to feel that they want to go into nursing as a specialty, as a career, and stay there for their life. And part of the way you do that is giving them a path to greater skill sets, to career growth, one of which is becoming an advanced practice nurse. For faculty for nursing schools across the country, Ben, lean on advanced practice nurses and other nurses that have upskilled and gotten additional degrees to be able to teach and train the next generation of nursing students across the country. All these capabilities are being put at risk right now because of this policy. They don't want you to talk about that. They don't want us to talk about this because how is this in any way America first? This is putting at risk the ability of our hospitals to fundamentally care for patients. Absolutely it is. It's putting at risk the advanced practice nursing specialty because where are they going to get the funds next generation to get this training. Who knows? Private philanthropy, very uncertain. Who else? Institutional funds, who knows? Will they provide scholarships? Incredibly uncertain. And then nursing schools. Nursing schools rely on faculty with advanced practice degrees to train the next generation of nursing students. Where are these advanced practice faculty going to come from? We're not going to support their education.
As former President Biden said, a job is more than just money. A job is about dignity. And in many ways, so much of what this Trump regime is doing is just taking away the dignity of people also. Like, as you mentioned, there's clearly a monetary ramification here, which impacts the ability of people to pursue degrees and access loans. Yes. But there's also like a dignity point of the presidency and this regime right now before Thanksgiving, looking at the nursing community and saying, you know what, F you. You don't matter. And they're doing that with lots of groups across this country, but particularly right now too, like people on the front lines of saving our lives. And, and one day, Trump's going to need, now or whenever, it's like, what are we doing here? So lastly, I just want to talk about CDC, because I think this isn't getting enough attention. That they're, tell us about the new number 2 and what's going on there.
Yeah, this is a guy who, unfortunately, the new number 2, Louisiana Surgeon General, former congressman, physician in name only, doesn't actually actively care for patients for many, many years now. Now is the number 2, the principal deputy director, highest ranking MD in the CDC, and is a guy that did all the things that Kennedy is going to like. He's promoting ivermectin as a treatment for COVID. He's against vaccines, and not just the COVID vaccine. He's put into question the hepatitis B vaccine recommendation for children, for infants in the first 24 hours of birth. I mean, really fundamental things he's called into question. And he's now the number 2 at the CDC, and he's the highest ranking MD at the CDC. And this is what he's been saying. And so I say this because it's important to recognize, 1, what we're up against, this threat to medicine. 2, the complete lack of credibility of the CDC now as we enter the next few years of the Trump administration. If we ever doubted it, I think it's clear, Ben, that anything out of the CDC now cannot be trusted. Before, in the first few months, there was career staff. There was still a lot of legacy staff that were pushing back, that were still in their jobs, trying to do the right thing. And I think now you're seeing there's been a complete hollowing out of career staff. A lot of people are leaving. A lot of people are leaving in protest. So there is quite literally nobody to stand up anymore against what we're seeing. And Kennedy's replacing it with yes people that are just going to simply do his bidding. So that's a clear implication here. You cannot trust the CDC. And 3, just to make sure I emphasize this for all our listeners, I'm on the West Coast, just like you are. The West Coast Health Alliance, led by Governor Newsom and the governors of Washington State, Oregon, Hawaii. But I would position Governor Newsom as really the shepherd of this effort here from a public messaging standpoint, especially. It's falling onto states and alliances like the West Coast Health Alliance to say, enough of what the CDC is doing. We're going to go our own way to protect our own citizens. And that's what you're seeing here. You're seeing states and alliances of states say they don't trust the quackery happening at the CDC level anymore, for good reason. So we're going to focus on people that we trust and messaging that we trust, coming from sources that are credible, that are evidence-based. And that's what's happening.
Dr. Vin Gupta, leader of Meidas Health, thank you so much for sharing your expertise.
Thanks, man.
Everybody hit subscribe. Let's get to 6 million subscribers.
Want to stay plugged in? Become a subscriber to our Substack at MeidasPlus.com. You'll get daily recaps from Ron Filipkowski, ad-free episodes of our podcast, and more exclusive content only available at MeidasPlus.com.